Hey guys, so today I'm going to be sharing the first part in a series regarding the dynamics of the operating room. And this is really geared towards medical students from the perspective of a surgeon because I have interacted with a lot of medical students who may be new to the operating room and really do want to do their best to be helpful, but because all of this is so new to them, they're not sure how or when they can do things. So I want to address that with this video. So I'll begin with the OR personnel. I think it's really important to know all of the people that you're going to be working with through the day and for them to also know where you're at in your journey in surgery. So the first one is the circulating nurse. Now they have a lot of different roles, and I'm not going to go through every single thing, but they are very integral to the operating room flow. They help with patient safety. They help make sure that all of the equipment necessary for the procedure is available. They help with things intraoperatively. For instance, if you need a specific stitch or something, they can help get that. And then they help with a lot of the post-procedural activities. Then, of course, you have your scrub tech who is in charge of making sure all of the sterile equipment is available. They scrub into the case and they help the attending surgeon. The attending surgeon is the primary surgeon who's going to be performing the procedure. And then they usually work with someone who is known as a first assist, who is helping the surgeon perform the surgery. So that could be a resident, it may be a fellow, it may be a surgical PA, or it may be a registered licensed first assist. And then, of course, you have the anesthesia team. The anesthesia team is made up of anesthesiologists who may or may not be supervising a CRNA or an AA. There may also be a resident or a medical student involved as well. So, who do I introduce myself to? I think that when you're working with this whole team of people, you try to introduce yourself to everybody you can. So in the morning, if you can get there early, introduce yourself to the circulator, introduce yourself to the scrub tech. You'll be working with them very closely throughout the entirety of the day and let them know where you're at. Let them know if it's your first day. Let them know if you've been in the operating room before, if you're familiar with things already, so that they have a sense of where you're at and if they need to help give you some guidance during the day. Of course, it's important to also introduce yourself to all of the people that you'll be scrubbing with for the day. So the attending surgeon as well as the first assist, we're all working on a team. And so I think that whenever you're scrubbed in a case, you want to know everybody who's there so that you can all help each other. So this is a schematic on the OR setup because it's good to know about how the OR is set up. And this is geared towards a general surgery or urology type of case. So you have the table, you have the head of the table, you have the foot of the table. These parts of the bed are actually different. They're not interchangeable. For instance, in a cystoscopy case, the foot of the table actually comes off so you can place the patient in the dorsal lithotomy position. So it's important to know where the head of the bed is, where the foot of the bed is, and know what type of procedure you're doing. You have the anesthesia team, which is situated at the head of the bed for these types of cases. Then you have the surgeon and the surgical first assist who stand opposite to each other in general. Then you have the scrub tech and the sterile equipment area. You want to be cognizant of that as you begin in surgery because it's not an instinctual thing to know not to be able to touch a table. So I think that as people are in the operating room more and more, they gain that situational awareness and it becomes second nature to them. But as you start out in surgery, it's important to know that area because you don't want to contaminate something because what happens is it really puts a delay to the case. We either have to get a new tray or sometimes you only have one piece of equipment available. And for you to get that piece back, you have to re-sterilize it and it could take some time. So making sure that you understand where the sterile equipment is critical to your day. And then also there will be other sort of cleaner equipment that's not necessarily sterile. So that you may have a laparoscopic tower, you may have a fluid system, an energy system as well. So how can I be helpful? I think that this is a tough question to answer because throughout the day, the dynamics of the operating room is changing. There's different personnel. You may have a new anesthesia team, you may have a new scrub tech or a new circulating nurse. And so it's not always easy to know where you can be helpful, how you can be helpful, and when. I think that having a bit of a framework as to the sequence of events in the operating room and knowing that sequence is helpful. It will put you in a position to know, okay, so this is what's going to happen next. So maybe I can help here, or maybe this is a time where I need to just take a step back and let other people do their thing. So my goal here is to just provide a little bit of a framework so that you understand the sequence of events so that you know the different time points where you might be able to help. And you can carry these points into any case that you're going into. So the first things first, the anesthesia team is going to bring the patient into the room. I think it's important to know how the patient's going to be positioned for the procedure that you're actually doing. So it's important to know what case you're doing. You can ask the circulating nurse or the first assist or the surgeon how the patient's going to be positioned. And the reason that's important is because when the patient is brought into the room on the stretcher, they are usually placed on the operating room table. There are some very rare instances where the patient won't be immediately moved to the operating room table. And the one scenario that comes into mind is when we are placing patients in the prone position for a procedure. In those instances, we'll actually keep the patient on the stretcher and position them in the prone position only after they've been induced on the stretcher. It's not a very common thing, but it's important to know how the patient's going to be positioned. So in most cases where the patient is just laying flat or supine, the stretcher is brought into the room. It's aligned to the operating room table based on where the anesthesiologist will need them. And then the patient is brought over onto the operating room table. And this is certainly a time point where you can help. I think just by standing by the OR table to help receive the patient from the stretcher is helpful because you can help act as a security so the patient is aligned appropriately and doesn't fall too far off from the edge of the bed. Once the patient is on the operating room table, the stretcher can then be taken out of the room. You want to make sure that when the patient is sliding over from the stretcher to the operating room table, you want to make sure that the stretcher is locked in place. And I think having more people being aware of that is helpful for patient safety. Once the patient has moved over to the operating room table and the bed is taken away, the patient will be secured to the bed with some form of a safety strap. And at that point, once the patient is on the bed and is secured to the table with a safety strap, you can get an extra blanket or pillow in case the patient needs it or you're asked to get that. So I think talking to the circulating nurse and the scrub tech prior to the procedure and knowing where those things are housed in the operating room is good to know so that if someone needs it in the future, you can be ready to get that. You can also help place the sequential compression devices at that point if it's needed. And then the next step, once the patient is secured on the table, the next step is inducing, intubating the patient, securing the airway, and making sure all of the lines that the anesthesia team needs, such as the peripheral line or arterial line or even the central line, are all in place. This is a critical step of the case. And as a newer medical student, I think at this part of the procedure, I would take a step back and just let the anesthesia team do their thing. In some instances, the anesthesia team will be okay with you working on things while they are doing stuff, but in general, if you're brand new to the OR, just let the anesthesia team do their thing at this part of the case. You can find a safe area to just sort of stand by and make sure you're out of the way of anybody and just observe at that point. Once the airway is secure and the anesthesia team has their lines in, that's when you can start doing things. You can start bringing the blankets off the patient to expose the area that's going to be operated on. Or if they're going to be repositioned, you can do so once they're secured, their airway is secured, and all of the lines are in place. For instance, in urology, if we're doing a cysto case, once the airway is secure and all the lines are in, we bring the pelvis down to the break at the foot of the bed and then place the patient in stirrups and perform a cysto. So that can be done at that point of the case. If a Foley catheter needs to be placed, once anesthesia is done with inducing and getting their lines, that's when you can place the Foley. There are some anesthesiologists who I think will allow you to work in parallel with them, but I would ask before doing anything, let them finish their thing before you start doing anything. And then once all of that's done, once the patient's induced and secured on the table, that's when the patient can be shaved, prepped, and draped. One thing on prepping, I think when you're starting out and you're brand new, you definitely want to leave that role to either the circulating nurse or the attending surgeon or the first assist. I think as you become more comfortable, that role may be given to you, but definitely as you're starting out, you want to let someone else do that. So then hopefully you've done your case and everything went smooth, and then the patient's surgical site is dressed, and the patient at that point is usually awakened or extubated prior to moving them back to the stretcher. Again, that's the anesthesiologist team preference as to when the stretcher is going to be coming back to the operating room table. I think it's important to let them lead that because you don't want to bring the stretcher into the room too early, because if they're having any issues with the airway, that may impede them from getting to where they need to get if the stretcher is in the room. But once the anesthesia team is okay with the stretcher coming back into the room, you can help bring the stretcher into the operating room at that time, and you can align it next to the operating bed. And then once the bed is locked, you can help slide the patient over to the stretcher. And this is done with a slide board placed under the draw sheet, or sometimes there's a separate sheet that's placed on the slide board, which is placed under the patient. And then you definitely will have to make sure that the stretcher is locked in place before you're going to slide them over. Once the patient is slid over to the stretcher, you can unlock the stretcher, raise the safety rail, and then you can help the anesthesia team take the patient over to the recovery room, and hopefully you will have done your first case. So I hope that this gives a little bit of a framework as to the sequence of events in the operating room so that you can find ways of helping and have a better understanding of when you can help and when you can do things so that you feel like you're part of the team and that you're helping out. Again, I hope this helps everyone. If there are any questions, please leave them in the comments below. If there's any suggestions for other types of videos that you'd like to see, let me know and I'll address that.